Let's look at the situation in Limpopo. The Premier there, Stan Mathabatha, and the Health MEC, Phophi Ramathuba, earlier on leading the lighting of candles in remembrance of those who succumbed to COVID-19 complications. And also to usher in a new year, the province is also seeing an increase of a number of COVID-19 patients being admitted at hospitals. We talk now to the Limpopo Health MEC, Dr. Phophi Ramathuba, on plans for the return of travellers after New Year and what they're seeing now. Very good evening to you, and thank you so much for speaking to us, Dr. Ramathuba. So let's first start with the province's numbers today. Are you able to give us anything?
Evening to Iso, and evening to all your viewers, and thank you very much for giving us this opportunity. What we can indicate as a province to say that the latest that we did publish was showing that the total cumulative number of cases in Limpopo are now at 24,994, wherein 20,865 have recovered. We have recorded them as recovered, but we still have got with an increase in the active cases, which is at 3,537. And unfortunately, our number of deaths also has increased to 592. So that is the situation that we find ourselves in as of earlier on today. But there is still the latest that would be announced this evening, which we are still waiting for the minister to announce that.
Now, earlier on, as the festive season really got into full swing, you were complaining about the influx of, not necessarily the influx or the rising number of COVID-19 cases, which you said could possibly be attributed to the influx in the province. What are you observing now? Has this abated? What challenges will this lead to?
It did, unfortunately, because when we anticipated that Limpopo being firstly a tourist destination for many of our people in the country and also abroad, most of the people will choose to visit Limpopo come festive season. You know, most of our people will want to visit Kruger National Park and other areas. Secondly, most of our people who are still economically active are outside the province, mainly Gauteng, KZN, Western Cape, for job opportunities. And this is the time wherein some of them only come back home once or twice a year, and festive season becomes the period where they would be visiting the province. And we have noted that the province that we have mentioned were already declared having entered into a resurgence. And our fear, of course, was that those who are coming, especially being young, they might not even be symptomatic, and unfortunately, they will come and interact with the old and the vulnerable, and they will therefore infect them. Yes, we have seen, because on the 11th of December, when we did our first roadblock to try to check and do the campaign, on the joint campaign with the Department of Community Safety and Transport, we saw an increase in terms of number of vehicles entering the province. We continue with our campaigns up until the 18th. It was worse, I think, if I remember well, on the 18th of December, the cars that were passing at some stage, 1,900 cars in just an hour. So that tells you that a lot of people had visited our province. We are beginning to see that impact, because this past week we started recording for the first time in the past 24 hours. Firstly, we recorded 627 cases. As if that was not enough, we continue to increase to 757 cases. And last night, in the past 24 hours, we had recorded, I think it was 964 new cases just in the period of 24 hours. It has never happened in the province. You can see we are reaching the 1,000 mark. That it's being attributed to the fact that we have a lot of people that are within the province, and there has been a lot of, initially, a lot of social gatherings that people have been attending, especially young people. And the fact that this current variant that we are talking about does affect infect also young people, and those can spread the virus easily. The second issue that we have noted could be also causing is our family gatherings, family lunch, the Christmas lunch. We're seeing them today. I was in Polokwane Hospital even yesterday. In Petersburg Hospital, we've seen a lot of people coming being sick, and you'll find 2, 3 from one family member. One family household.
And Dr. Ramathuba, let me ask you this question. It might be difficult to answer given the fact that it's early days. You mentioned obviously the increasing numbers and because that there are more people in the province. Those who are straining the health system, I'd imagine that it's difficult to tell if it's people who actually live in Limpopo or if some of those could actually be visitors from outside of the province.
You see, what we have noted, especially when we look at the results when they come in, some people are even honest enough to give us their original addresses, which is not necessarily the Limpopo addresses. That's why even some of them, when you do the tracing, they will be able to tell you that my contacts are in Gauteng or are in Cape Town. So it is a mixture because one, I come from Gauteng, for instance. I come home, I'm positive, I don't even know. I then infect my mother. She fell ill. When she goes to the hospital, when we do history taking, my mother tells them she has been listening to the president. She has never left her household. But how did she get infected? Then she started to say, oh, my daughter Poppy works in Gauteng. She has just come back this day. When we go to test Poppy, that's when Poppy becomes positive. And even the aunts, and that's what we're beginning to see now. The aunties and the uncles. And when we ask, no, on Boxing Day, we had a family lunch, Christmas, we had Aritsibane, and this is what we are starting to see now. That what has been transpiring in the past week and 2 weeks when they arrive in the province. We're starting to see it by increase in terms of number of patients being admitted in our hospital.
All right. Now, there has been an allegation that there are people coming in from Zimbabwe with false negative COVID-19 tests, and it was said that the manner in which they describe these rapid diagnostic tests and how they've taken them, some claiming that it's been they've had blood tests, is a dead ringer for the fact that they are false, and that there's also been corroboration with Zimbabwean officials across the border who confirmed this. How widespread are these cases?
It is, so unfortunately, it has become widespread. We took a decision as the South African government that all those that are coming back would have to show their positive or negative results so that we can make a decision whether we are returning you or what to be done with you. So, of course, they know that we are looking for negative results for which are not older than 72 hours for you to access our border and enter South Africa. Now, what they are now doing, if you remember last week when they were leaving the country, we were saying that we will also assist our neighboring countries by checking those 72-hour results. So those who didn't have, we will assist them by testing them at the border post. Now it clogged the queues. We then decided to say, and anyone who wants to leave the country, for us to be able to clear that backlog which was there at the border post. Now this time around, people are coming back to South Africa. We can't risk and gamble with the lives of our citizens. We are very strict at the border post. What we noted, I'm sitting here with almost 17 fraudulent results that were sent to me by some doctors around Musina whom we have requested to assist at the border post, including the team that is working at our port health system. They've just sent me even this afternoon. You can see that these are not results. Some people just went to type letters to confirm that Poppy Ramathuba is COVID-19 negative. And when we asked, they were asking the question, how did they do the test? They tell no, they drew blood. It's a PCR test here. So it's becoming quite interesting to show that this has not happened. We have tried to follow up others to call where they fraud. There's a fraudulent even on the stamp for laboratory, and even the other side, our counterpart says could confirm that they know nothing about that. And what is said is that there are up to now around 17 cases where we did a retest as a Port Health in South Africa through our NHLS. What we have realized, they were all positive, these 17 that I'm referring to, and they came with false results that are negative. So we have a stamp and indicate, working with Home Affairs to say they should not enter South Africa, they must go back. So you will hear them coming back to complain about how South African government is. But this is not a time to be nice and to be darling of anyone. It's about our people here, and we think as government we've got to be firm. If you actually, if we had the resources, we would say you need to be arrested for that. But we are simple saying you're not going to enter our country. If you are coming with false results, you will not. We are going to detect those false results. We've got our own system on how to detect. Remember, at the border post, we have stationed, there are professionals there who understand all this. You don't even understand. You've gone to someone and you have paid that a $60 to get those results. Unfortunately, when you get there, you still are not going to access South Africa.
All right, thank you so much for speaking to us. Limpopo Health MEC Dr. Phophi Ramathuba speaking to us about some very worrying results there. 17 at the moment, she says that she's sitting with, of false negative tests from Zimbabwean nationals who are coming into the country claiming that they have had COVID-19 tests and are indeed negative. It's emerged that they are paying as much as $60 to get those fraudulent tests.